Welcome to the iPod, a podcast series from Ophthalmology Times, where we engage with key opinion leaders about the latest innovations in the areas of surgery, clinical diagnosis, drug therapy, research, technology, or practice management.
Hello, this is David Hutton of Ophthalmology Times. I'm joined today by Dr. Victor Gonzalez, who is discussing the results of a Phase 4 PALADIN study. Thanks for joining us today. Tell us about your presentation.
Yes, today I'll be reviewing the 2-year outcomes from the PALADIN 4 study. And this is basically a study looking at the use of fluocinolone implant in patients with persistent or recurrent diabetic retinopathy. And what the study entailed is looking at the outcomes in patients with diabetic retinopathy. These are individuals who typically require multiple intravitreal injections in order to have good outcomes. And, the objective was to see if there was a way to achieve the same anatomical and visual outcomes without having to burden the patients with recurrent and frequent treatments. So this study is an ongoing 3-year study. And what data I'm going to present to you today is at the 2-year cutoff. The study started a recruitment back in 2015 and is done recruiting, but is still active. Today, we will discuss the interim analysis of 150 eyes with DME that received the intravitreal implant. The subjects were followed at day 1, week 1, and month 2, and then quarterly from month 3 to month 24. The patients were stratified as to visual acuity, those with better than 20/40 visual acuity, and those with worse than 20/40, they were divided based on the visual acuities. They were also looked at to see what the central subfield thickness was in these patients at baseline. Through a special amendment, we were able to look at these patients to see what the experience had been both in visual acuity, central subfield thickness, and treatment regimen 36 months prior to enrollment to see if we could have an impact on these patients. The mean age of the patient was 67.22 months. The majority of them were female. The duration of the diabetic macular edema, the mean was about 4 3/4 years, so about 5 years, with a range of 1 to 13 years. Most of them were pseudophakic. The best corrected visual acuity at baseline was about 62 letters, and the central subfield thickness was 383, with about a third of them having a normal anatomy, which is defined as less than 300 microns. The best corrected visual acuity of 20/40 or better was also about a third of the subjects had a better than normal visual acuity. When we look at the visual outcomes in these patients, the 36 months prior to enrollment, there was a steady decline of visual acuity in these subjects, regardless of whether or not they had good visual acuity or bad visual acuity. When one looked at the treatment frequency, if one recalls the protocol T treatments regimens, for example, one knows that in the optimal visual outcomes in these subjects were achieved when patients were treated somewhere about 8 to 9 injections the first year, 2 to 3 the second year, and about 1 the third year. And these subjects in those 36 months prior to enrollment to the study had about 2 to 4 injections. So one can safely conclude that these subjects were severely undertreated. Now, you wonder why that's the reason. Well, I think it's not difficult to realize that, we have lives outside of the medical offices. So a lot of these patients were not able to come in for treatment because of variable reasons. And for that reason, the end result was progressive loss of vision in these subjects. When we looked at what happened to the patients in the 2 years after the fluocinolone implant, they either stabilized or gained 3 letters of vision. So there was definitely an important change in the downward trend that we had seen in these subjects prior to enrollment. When one looked at the time to rescue in these patients, one found that the need for retreatment in these subjects after the first year, the majority of the patients did not have any need for more injections in the first year. And even after the 24 months, 43.7% of the patients still had not required a second injection of any type of rescue treatment. So we could stabilize the vision, we could improve the vision in these patients with less interventions. When one actually looked at the number of injections in those 2 years, over 51% of the patients at 2 years required no injections or one. Almost 84% of the patients required less than 4 injections. So there has been a dramatic favorable shift in decreasing the number of injections to stabilize or improve the patient's visual acuity, which is what these patients needed, if you recall what happened the first 36 months. Also, when one looks at the central subfield thickness, if you look at what happened the 3 years prior to enrollment, the edema kept bouncing back and forth. There wasn't a steady downward decrease that one would expect if these patients had received monthly injections of the anti-VEGFs. Once the fluocinolone injection was applied, there was a steady downward stabilization of the central subfield thickness, which is what we want to see in these patients. When one looked at what percentage of patients had normal anatomy at baseline versus at 24 months, the number of subjects that had normal central anatomy was about a third, or 33%. That increased to over 42% at 2 years. So again, more patients achieved normalization of vision. When one looks at what happened to intraocular pressure, one's always concerned about giving intraocular pressure. One is always concerned about intraocular pressure when patients receive intraocular steroids.
Right.
What we found was that there was a stable pressure. So there wasn't a significant red flag from using the intravitreal steroid in these patients on label. When one looks at intraocular pressure events, one does see there was an increase in the need for intraocular pressure and lowering medications in the subjects who received the intravitreal fluocinolone. But the majority of these subjects were stabilized with pressure lowering medications and did not require filtration surgery. So in summary, the fluocinolone implant allowed for significant reduction in mean central subfield thickness from baseline to month 24 in all of these patients. There was an increased percentage of eyes with stabilization or normalization of the central subfield thickness. There was stable or improved vision in the majority of these patients with less intraocular injections. There was a favorable shift, as I mentioned previously, with over 50% of the patients receiving one or less injections with this improvement. And the intraocular pressure was predictable and manageable in these patients. So the end result was that we were able to improve and stabilize the patient's function and allow the patient to live without being dependent on intraocular pressure, without being dependent on intravitreal injections. And there was a marked improvement in the functional and visual outcomes in these patients. This study clearly demonstrates that there's a way for us to improve the management of these patients without making them slaves to monthly injections.
Thank you so much for freeing up your time for me this evening.
Thank you, David.
Take care.
Thanks for listening to this episode of the iPod. We hope you subscribe at iTunes and let us know what topics you'd like to hear more about. Stay connected by going to ophthalmologytimes.com, subscribing to our newsletter, and following us on Twitter, Facebook, Instagram, and LinkedIn. We'll see you next time.